So in this video, I have the help again, my lovely assistant, Nanami, and I'm going to go through some stretches, mobility exercises for your lower back. So really nice exercises if you're a bit tight in your back, if you have non-specific lower back pain, and tight hips to go with it. So start slow and add progressions, and you can figure out what feels good for you and what level you're at. So a nice, very common exercise that you might have done yourself already with lower back pain is hip rolls or knee rolls. And so what I'll get you to do is just take your arms out the way, out to the side, maybe bring your legs together, and then just however you want to, take your knees over to one side. Yep. And then the other side. Good. So quite a familiar exercise perhaps for some of you, but there's a few tweaks that you can do along the way that might just help to make it feel even more helpful. Okay, so if you take your knees over to this side, let's see what. So this is very much a Pilates hip roll that you're doing. I was just checking her feet there. So she's hip rolled over to her left, and her right foot has left the floor, which is what we teach in a Pilates hip roll. So come back to center. So sometimes you might want to just see how it feels with both feet. Just do whatever you want to do with your feet and your knees. Does that feel any different?
A little bit.
A little bit in a good way or?
In a good way.
In a good way. Mm-hmm. So let's do each of them, each of those versions. So for this one, we'll do the Pilates version where we keep the legs connected and the feet connected. So the movement, and come back to center. How I would cue it in a class is the movement actually comes from the pelvis. So your pelvis, your hips are going to roll to your right, and your knees come along because they're connected to your hips. That feel a bit different? Mm-hmm. Then you use your tummy muscles to pull your knees back to center. So your pelvis rolls to your left, knees come along with the right, they stay pretty connected, and your foot leaves the mat. Okay, that feels quite nice. And you can have your arms out to your side, so you can play around with where you have your arms. You just do that a couple more times. You want to make sure too that your shoulders, arms stay pretty much connected on the mat or on your bed if you're doing it on your bed. You can just repeat that a few times. Now, if it feels like a nice stretch and you want to hold it, that's absolutely fine too. It just might feel a bit sticky as you come back. So I'd really take it slow on the way back and make sure you use your abdominal muscles to do it. Okay. Good. And you're doing a really nice job. So what can happen here is if you come over to this side, what can happen is there can be a bit of a pinching in the lower back because we're maybe allowing the ribs to flare forward. Can you do that? Yeah. Yeah, so the ribs are now flaring forward. The spine is now in extension. Yeah? So those joints at the back of the spine might feel a bit more grumpy, do they?
Yeah.
Yeah? Okay. Feel it a bit more there. Mm-hmm. So use your abs to come back to center. Sorry. So just do this side so the audience can see. Mm-hmm. Come over to this side and we'll do that little cue where you're already doing it really nicely, where you're thinking about the spine, the muscles on this side, hammocking, dropping down towards the mat as your pelvis comes over. So now the spine's actually curving down to the mat rather than flaring away, perhaps pinching into your lower back. Use your abs to come back to center. And then just do the same on the other side. So the hips are going over as your spine is hammocking down. All this space here is just dropping as you let it drop and relax and go. Rib cage softening to the floor. Okay? And then come back to center. So you can play around with having your legs together like this. You can have them maybe hip distance apart. You can see how that feels. That might feel just a bit different. So it's quite good to explore all this and find the stretch that suits you and your back and what feels good for it. There's no wrong way to do it. There's just these little tweaks that can maybe help your back out a little bit if the exercise is perhaps pinching your lower back, if your muscles are naturally doing the bracing that it likes to do with lower back pain. It's trying to find a relaxed spine as you're doing your hip rolls. Yeah? Mm-hmm. Okay. So we're next going to do the corkscrew stretch, which is a bit stronger. So if you bring your legs together, let's bring your right knee, cross it over your left. Completely, yeah. And I'll just shimmy up here out the way a little bit more. So this might be quite strong. So you're just going to take it slow to begin with. Your right arm's just going to be out to the side. You're going to just make sure your right arm shoulder's connected on the mat. You can bring your hand to your knee. And the corkscrew stretch is this big rotation. So you're going to bring your knee over to this side and you're just going to stop whenever you feel a stretch. So depending on where you're tight, you might feel it in your glutes and your buttock muscles. You might feel it right in that lower back joint. Hopefully that's kind of what we're aiming for. The lower back somewhere. It might even track up to your rib cage a little bit. And that might mean that you've gone a bit too far or you've let your rib cage flare. In this case, you want to just, again, make sure your spine is hammocking down, your rib cage is hammocking down to the mat as your pelvis is coming over. You feel that stretch your lower back or somewhere else?
More in my glutes.
More in your glutes. So for some of you, it might be a really good glute stretch. It might not target your back. It doesn't mean to say it's a bad exercise. It's maybe just not for you if you want to get into your lower back, because it is a tricky area to stretch. So we'll just see if we can tweak that a little bit. Let's do the other side, see if it feels any different. Cross your left over your right. Hand on your knee, and you're going to let your leg go over to that side. Yeah, and so what I'm seeing from here is that there's just a big block of movement. We're not getting separation of Nanami's rib cage away from her pelvis. So what I would do here is just maybe put my hand, if that's okay, on your rib cage. This is going to drop down as you're going to softly let your pelvis go over, and it can do the tiniest of tweaks that can make all the difference. Is that still in your glute, or is it more
in my back?
More in your back. Great. So yeah, and you're going a bit further and a bit further. So you can just kind of, you might even need a bit of support. Maybe you need a cushion on that side so that your foot can stop. If you're really bendy, your foot will find the floor. Nanami's not bendy. Are you bendy? No. And that's okay. All right, so you're just going to hold it and just explore those little tweaks. As you breathe, relax. Think about your lower rib cage softening down as your pelvis is coming over. You might find it better to bring your knee closer to you. Tiniest tweak can make it feel completely different. Or even knee a little bit further away if you can reach. That looks good. Yeah. And then because you've been there a while, so quite slowly come back. If you snap out of this exercise when you've got a grumpy, spasmy, crampy back, it's going to let you know about it. So just do it slowly and it won't hurt you. Okay? So that's the corkscrew stretch. We'll just do it one more time on the other side, just to see if you can, because you found it on the left side, you found the stretch in your lower back on the left. Let's give the right side a go. Where you're going to think about separating your rib cage away from your pelvis. So if it's okay, I'll just put my hand here. Your rib cage is going down to the floor. Yes. As your pelvis is coming over. There has to be sometimes a kind of, I need to make this happen by, these little tweaks and making it relax in that position, allowing it to separate. You feel the difference there a bit more? Yeah. Okay, so it's a good one to explore and find. Come back. You still okay? So we'll just whiz through a couple of stretches for the glutes and the deep hip rotators. And we'll see how they feel. So let's do the glutes first. We'll do the right side. We'll do on both sides so you can see. If you bring your leg up and you're going to do the position where you bring your knee out and your lower leg is going to rest on that thigh. Yeah, so it's kind of a bit like a figure of four kind of, and that's a nice mobility there. If you've got a particularly tight hip, then your knee might not go out as nicely as Nanami's. It might be a bit stuck here, and that's absolutely fine. If that's the case, I'd encourage this first movement where you put your hand on your knee. Yep, and you can press it away. Ice cold fingers. And then bring the knee in and out. So you can this is a nice mobility exercise. Not only for the hip, but your lower back joints will be getting a bit of movement in there too. Okay. And if it feels quite nice to push that knee away, hold it for a little while. You're then aiming to keep the knee out. So you're going to gently keep it pushing out as you bring all this into your chest. Okay. And you can hold on to your lower leg with this hand. Now, for some people, this is not a comfortable exercise because it can be quite difficult to reach your leg for some people, and it can be a bit hard on the back. You can probably see here your tummy muscles are bracing because it's sometimes not an easy exercise. So what I'd suggest is try a few things. this leg is helping. Yeah, that leg's helping, which might mean your hip flexor on this side gets a little bit crampy. Yeah, if that's the case, as long as the shape of this right leg that she's stretching is the right shape, you can put this down. Yeah, and then you can use your hands to hold on to that leg, because it's important to relax the leg that you're stretching while you're stretching it. Okay, breathing, quite relaxed, head down. Okay, no tension at all. Are you feeling that stretch anywhere? Whereabouts?
Yeah.
In the glutes somewhere? Can you bring it into your chest a bit further? You might need to use this leg. You might need to, yep, yep, that got it going a bit more. Okay, so you can explore how far you come in. That's part one. Then you can play around with how different positions to use. And these are tiny little tweaks. So you can use your hands here, stretching this relaxed leg. You can maybe bring it across. How's that? Tight, out.
Yeah.
So you can do this kind of sweeping motion, this kind of rainbow motion. And if you find it a bit tighter as you go over here, maybe you want to hang out here for a little while, take a few breaths. Now, if you bring your knee in, the stretch probably goes. Does it kind of disappear a little bit? So you want to play around with, can you push your knee away as you bring that shape into your chest? Okay. And then bring that right in. Yeah, like that. Okay. And then relax. Put your leg down. Let's do it on the other side just so you can see. Cross your leg over. You're going to bring that in by using your knee. Yep, you can move the knee in and out if you want to as well. Put your hand on your shin, hand on your knee. You're pulling your shin towards you as you're pushing your knee away and then bringing that into the chest or wherever you can get to. That's it. That's fine. I'd also suggest too in this position, you're using this knee, you're relaxing this leg, you're holding on with your hands. Just check your sacrum's relaxed too, that your back is relaxed on the mat, that it's all soft, because that can really help the stretch feel a bit stronger too. So then you can do your rocking motion from side to side, finding any bits in there that are a bit tighter. And then you can play around with how far into your chest as you push the knee away. Yep, like that. Those faces are good. Finding the tight bits. Okay. And relax. Lastly, we'll do the deep hip rotators. And I find this is a really good one and often missed when stretching out the hips and the lower back. So legs together. This time, cross your right leg completely over your left with no gap. Yep, just like that, as if you're crossing your legs over when you're sitting. Then bring that into your chest. Hold on to your legs. Yep. So Nanami's automatically holding on to the knee closest. This is the leg that she's stretching. Some people can wrap right around these knees because they're nice and bendy. But actually, we just want to focus on the leg that we're stretching. So this is coming in. Do you feel that already? Is that quite strong? And again, this leg can go down on the mat if that's more comfortable. Okay? Whatever feels best. So the little tweaks for this exercise, you're already bringing it across into the midline, even across the opposite shoulder. If you're a bit tight in your hip, the knee might swing just into that shoulder. And you might find it quite difficult to bring it into the midline. So that's what you're going to work on. If your knee automatically, so this is the right knee, if when you bring it in and across, it wants to swing out to the right shoulder, you're just going to work to bring it gently into your midline, where that might feel quite strong for some of you. If that's easy, you can come all the way across to the opposite shoulder, where it gets a little bit tighter. Then you relax your sacrum, you make sure you're breathing. Yeah, everything's relaxed. Last little tweak for this, you want to keep that where it is. Slide your hand down to your lower ankle, and you're going to pull that towards you, which might not go very far. When you do this bit, and you'll see it better when we do it on the other side, the knee might swing out to that shoulder again. So you want to still draw that into your middle as you're holding on to this low leg and pulling it in where it feels pretty tight. Yeah. Let's just do all that on the other side because it's a bit easier to see from the other side. Crossing over, bringing that knee in, holding on to that. See how that feels. Take your time here. Knee comes into the middle chest. Spending a while here if it's tight. And then bring your hand to your lower ankle and you're drawing that in. So that adds that extra bit of rotation into those deep hip rotators. The knee might have swung out to the side, which it has a little bit on this side. So you're going to draw that in and across and over as you draw that leg in. Yes, and it's very strong. But we're going to embrace that and we're going to relax. It has to still feel therapeutic though, which it should do. It shouldn't feel like a strain. You just hold that for however long it feels good to hold. Making sure your back's relaxed, your sacrum's relaxed. And then you can go. Give them a go.